You all, I have no childcare coverage tonight, so I appreciate the ability to be able to participate remotely. So welcome everyone. Calling to order the Boulder County Board of Health regular meeting, October 21st, 2024. It is exactly 5:30 p.m. Do you want to do a roll call, Jordan, of board members before we begin the agenda here?
Yes. So I would call your name. Please say here. Morgan McMillan, President.
Here.
Yes. Vice President Landry Bacon. Here. Board Member Amber Johnson. Here. And then we have Brooke Harrison's not here quite yet. Lindy Hinman will be here soon. So we have a quorum.
Great. Okay, thanks everyone. Item number 1 is public comments. I know we received a written comment. I don't know if there is anyone else who joined at the last minute for public comment.
Nope, there are no spoken public comments.
Okay. Thank you for the person who sent in their comments. Item number 2 on the agenda is approval of the September 9th, 2024 regular meeting minutes.
Need a motion to approve.
And I second.
Great, thank you. All in favor? Aye. Okay, minutes have been approved from September 9th. Thank you. Item number 3, board business elections. Guess we don't quite have everybody on the phone yet.
Do you want to come back to this one?
I think we should come back to it. Yeah, just until we have the rest of the board, if that's okay.
Yeah, that's
okay.
Like Lindy.
Yeah, we'll just sign them up for everything.
Is Lindy? Yeah, that's Lindy's phone number. Yeah. We'll wait till she gets here in person so we can move on to staff.
Okay, great. Item number 4, staffing announcement.
Okay, well, welcome everyone. Lexi Nolan, Executive Director of Boulder County Public Health. I am pleased to announce 2 new members to our admin and finance team, specifically working, especially lately, on budget and finance. Armando Guardiola is our new admin and finance director at BCPH. Armando comes to us from the city of Commerce City, where he was the chief innovation officer. Armando is a seasoned leader with extensive experience in operations, financial management, and strategic growth, and brings a results-driven approach to his work. He holds a master's in accounting and a bachelor's in social science from Regis University and has successfully led teams across both public and private sectors. He has a proven track record in budgeting, financial reporting, and implementing Lean Six Sigma process improvements. He's a black belt. His extensive expertise in these areas will be invaluable as we continue to streamline our processes and enhance our financial and administrative operations. His prior roles include Chief Innovation Officer, Director of Human Resources, Deputy Finance Director for Commerce City, where he executed key financial and operational strategies. Welcome, Armando.
Thank you. Thank you for the introduction. And I'm excited to be here. I think on day 33, so real excited and looking forward to a long career and hopefully making some positive changes.
Well, I know we're already keeping you busy, so thanks.
Our second staffer joining us this month is Sarah DeVore, who joins us from the SAS Institute, where she developed governmental data analytics opportunities in Colorado and Idaho. Prior to SAS, Sarah worked for the Colorado Department of Human Services as the budget director and legislative liaison. She managed the department's annual budget development process and legislative strategy, including passage of 2 child welfare reform packages and the behavioral health crisis system package in the wake of the Aurora Theater shooting. She also served as the government relations manager at Denver Health and Hospital Authority, as a budget and management analyst for Governor Bill Ritter, overseeing budgets for the departments of agriculture, healthcare policy and financing, human services, and transportation. Sarah has a double master's in public administration and technical communication from CU Denver, and her undergraduate degree is in exercise sports science from Colorado State University. Sarah joins us as a senior budget analyst. Welcome, Sarah.
Thank you.
Indeed. Welcome, Sarah. Thank you. Thanks to you both for jumping right in. I guess we'll just keep moving down the speaking of jumping right in. Well, oh no, we've got sorry, item number 5 first. The strategic plan approval.
Want me to jump in?
I'm happy to introduce. Welcome back, everyone. We are extremely pleased this evening to present the final strategic plan approval. Rachel's going to walk us through some comments that we got from the board and a couple of minor revisions. As per our discussions with the board members in response to their comments, we will ask for a vote tonight pending those minor changes. And we just really appreciate everyone's accompaniment on this journey to get the strategic plan done. And our teams are already busy working away on the first quarterly report, which we will come back to you with in November.
All right. Hello, my name is Rachel Mintel, Health Planner, Strategic Initiatives Branch. Back with you again to chat about the strategic plan. As Lexi said, we're here to ask for your formal approval. Just a few updates and like Lexi said, a few small revisions that we'll be making. If you could go to the next slide, please. So
And I'm so
through-
sorry to interrupt. I just got a note from Brooke that she's waiting to be admitted to the meeting. So I don't have a way to send you a note, Patrick, about it.
I got in for some
Great.
reason.
Okay, great. Okay.
It is
Thank-
failing on the web, but it worked when I re-updated Teams.
Okay, that's good.
Super. Sorry for the interruption. Glad we have you here, Brooke.
Awesome. Okay, so again, a few kind of minor revisions that have been made and then some suggestions that I'll talk through. So some revisions that we will be making. So to start, we made a few minor edits to the health justice framework. So the updated version of the strategic plan that you received page 15, if you're interested in reviewing those minor edits, some minor wording changes there. Based on some of the suggestions that we received from the board, we'll be working on increasing some specificity on the objectives. So really looking at being more specific to help demonstrate to the readers what we're trying to accomplish within each priority. Really looking at community engagement, emergency preparedness, response and recovery, and climate action and sustainability. Additionally, adding language or referring readers to the logic models so they can either referring them to the logic models where they can find that information, or again, adding some of that language from the logic models to help inform the reader on how we are going to accomplish the work that's outlined in the objectives. So we plan to share that feedback with the work groups and then work with them to adjust some of that language and incorporate those suggestions into the strategic plan moving forward. So those are kind of the revisions that we'll be working on pending approval. We'll kind of add those in as we move forward. So just wanted to kind of share some of those updates that we'll be working on. Next slide, please, Patrick. Before we go to the official ask for approval, wanted to see if there were any other questions or clarifications that we could respond to you guys from the board. If anyone has any other questions. Thank you. I know it's been a lot.
I just want to share my appreciation for your incorporation of board feedback too, and all the work that has gone into prepping the strategic plan, and then your willingness to incorporate some of our suggestions too. So thank you.
Yeah, hey guys, this is Lindy. I just wanted to second that. I appreciate the time you've spent with me personally going through this and clarifying some questions that I had. And I appreciate the journey you're on here in terms of developing this recognizing that it's an evolution, it's an iterative document, and it will continue to live and change as the strategy of the organization continues to evolve. So thank you for all of that.
Okay, with that, we would like to ask the Board of Health for approval for the 2024 to 29 strategic plan.
The 2024 to 2029 strategic plan.
Second, that approval.
Great. All in favor of approving the new strategic plan?
Aye.
Aye. Great. Congratulations on this important step and all of the work that's gone into building this. So good work, and thanks to the staff for your leadership on this, and we look forward to supporting its implementation.
Thank you very much. We'll see you next month for the first quarterly report. Thank you.
Great.
Morgan, would you like to go back now, or however you want to do it is fine for us?
Okay. I know that Lindy, you're on your way. Are you able to have some board elections en route wherever you are now?
Yes. Yep. I'll be there shortly, but I'm happy to do this by phone in the meantime.
Okay. Great. We will go back to item number 3, board business and our elections. Jordan, I don't know if you want to tee us up for
Yes.
Great.
Oh, sorry about all the confusion of the non-updated teams. I wrote a note. We'll chat with our IT to make sure external people are able to join the meeting without going to the waiting room. All right, good afternoon, all. My name is Jordan Thomas. I'm the Business Operations Manager and Board of Health Liaison. I use she, her pronouns, and this is the annual Board of Health election that we hold every year based on our Board of Health bylaws. So for consistency's sake, I'm going to read these excerpts from our bylaws just so we're all operating off the same information. The board shall elect from its members a president and a vice president, hereby referenced as officers, and such other officers as deemed necessary by the board. All officers shall hold office at the pleasure of the board. Board officers shall be elected annually from the membership of the board at the October meeting or at the first meeting after the occurrence of a vacancy involving a board officer. Newly elected officers shall assume office at the conclusion of the meeting at which elected. The duties of the officers are: the president shall preside at all meetings of the board, appoint committees, and perform other duties that our parliamentary custom requires, which is Robert's Rule of Order. And for the vice president, they shall act as president in the absence of the president. Morgan McMillan is currently serving as our Board of Health president, and Landry Fagan is currently serving as our vice president. So I'll now open the floor to the board to determine if they would like to nominate a different member as president and or vice president. If there is more than one nominee, I'll conduct an anonymous ballot process. And once the board selects and agrees on nominees, I will request a motion and a second for approval. So I open it up to the board.
Can I nominate Lindy Hinman for vice president?
Okay.
Do we need to also renominate Morgan McMillan?
Yes.
President?
Yes.
Can I redo that too?
Are there any other nominees for this process? Do our nominees accept?
I do. Thank you
I
for
also
the
accept.
nomination, Landry.
So now I will formally request a motion and a second for this officer change for the Board of Health starting tomorrow.
Motion to. Second.
Okay. Sorry, I take notes. All right, so the next steps, the Biz Ops team, we will update our documentation in the Board of Health website. Congratulations to our president and vice president for this year.
Thank you. Thanks, Jordan, for
Thank
keeping
you.
us, on task and in alignment with our bylaws. And I do want to take a moment and just appreciate, Landry, your leadership in the VP role for the last, I think, 2 years, right? I think something like that, maybe more even.
Oh,
1 or 2.
that was long.
Seems like yesterday.
Seems epically long. No, really really just appreciate your willingness to be in a leadership capacity on this board. And as we all know, it's there's plenty of work for all of us to go around. So so thanks also to Lindy for her willingness to step into a leadership role this year, and to all of my fellow board members for continuing to plug away at doing what we can to support this organization.
Thank you, Morgan.
Okay. Well, I'm going to move us back up to item number 6. Standing agenda item budget updates.
Good evening, Board of Health. Thank you for taking the time to join this important discussion about our budget situation and the steps we're taking to address our projected financials as we move to the 2025. Today, I'll be providing an overview of the current budget challenges, the corrective actions we're implementing, and our plan for ensuring an accurate and sustainable budget process moving forward. A little bit of background. I'd like to provide an overview of the financial landscape, particularly highlighting the substantial budget increase we experienced during the COVID-19 pandemic. While the influx of resources has been critical, it also has led to reconciliation challenges due to the introduction of new financial systems over the past couple years. Our complex grant structure with 3 different grant cycles each year, further complicating financial management. To navigate these issues, we need to implement and improve our systems, facilitate better tracking of funds flows, our funds flow, and enhance our internal controls. Additionally, I recognize the ongoing uncertainty among staff regarding reserve levels and the use of county funds, which need to be addressed to foster confidence. On a positive note, public health has consistently returned clean audits and clean opinions, indicating that our challenges are primarily with the budget process rather than the systematic issues. Moving forward, addressing these challenges will be essential to our continued success. Maybe.
Because I clicked on something else.
Oh, okay, sorry.
I was muting Lindy as she walked in, so you get that noise.
Technical difficulties.
Yeah.
So, and so a little bit of forensic accounting is what we've been doing. So in the recent year, public health budgets have primarily relied on historical budget numbers rather than actual expenditures. This approach has resulted in inflated budgets, masking potential savings, and leading to inaccurate reserve projections. While we can confirm that Oracle expenditures have been accurate and in line with our OpenGov, there is some challenges that we're currently working through. It is also important to note that public health's fringe rates are actually lower than anticipated, which have actually provided some surplus. These discrepancies have created a surplus of the workforce expenditures. As we move forward, it's critical that we shift our budget strategy to better reflect actual spending patterns. This will help us create more realistic budgets, improve our financial forecasting, and ensure that we have a clear understanding of our reserves.
It should work.
So in response to our financial challenges, we have undertaken several key efforts to improve our budgeting and reconciliation processes. First, we've initiated the reconciliation of data across various systems, including the 24 budget resolution that was originally adopted December 11th, 2023. We've also worked with the county to make sure that we are aligned with what was adopted, what was also in OpenGov, Oracle, and then our internal budget workbook. This ensures consistency and accuracy in our financial reporting. Additionally, we've corrected the county allocation to public health for the 2024 budget, allowing us to align our resources more effectively We are recalculating our 24 expenditures based on updating fringe rates, providing more accurate financial picture. And to enhance our financial management, we are creating a system for tracking salary savings, which will help us identify potential efficiencies. Finally, we revised our 24 spend down projections and reserve based on the updated expenditures, which I'll share shortly. And we have also completed the 24 budget amendment proposal that will be coming to you here in October. These efforts are aimed at fostering greater transparency and ensuring our financial stability moving forward. So this is a really important slide that I want to kind of introduce minimally without giving too much information. I just want to kind of highlight what we found. So as of now, currently we projected a total of revenue of 24 million and expenditures of 22. This gives us a surplus of 2 million or 2.1 million added to the end of fund balance for 2024. If you look at this slide, I'm going to move away from my script a little bit just to talk a little bit about this slide. So if you take a look at this slide, we budgeted 23,944,863 as a budget. Our actual projection coming in, if we look at audited financials, we project based on the actuals at the end of 24, we're going to come in with 24,455,301. That's actual revenues that are coming in. That is contributed to about 2 million. That is off. It's a separate line item in our revenues, and we have those broken down. It's primarily some surplus that we're receiving that we didn't anticipate when we were budgeting. The second number that I want to talk about is the budgeted expenditures. If you look at the budgeted expenditures for 24, we're budgeting, or we have budgeted right now 26,794,812. What we're actually seeing, which is more in line with actuals and audited numbers that actually have come from our financial statements, is we'll finish the year with 24 with 22,335,440. So there is a surplus of about 3 million. I think it was 3 million in regards to, or a little bit more over 3 million, but 3 million of it is actually coming from workforce, and we can go into more detail. We broke that down, how we can identify where that money came from. So a big number that I want to point out is starting the fund balance in 24. We started our fund balance at 7,163,520. If you look at your actual financial audit and your financial statements that were presented to you, I believe in August, that was the ending balance. So very healthy fund balance at the end of 23, starting 24 with 7.1. The budget, unfortunately, because of the budget and using budgets to budget instead of budget to actuals, we projected that we would start 25 with $4.3 million in fund balance. A little bit different story is after looking at some financial analysis that the team has done, we believe that we'll come in about 1.2 million in fund balance, allowing us
9.2.
Oh, 9, did I say? Oh, 9.2, sorry, my eyes. 9.2 million in fund balance. And we can talk a little bit about how that came upon, what it looks like, and the breakdown for the fund balance. Any questions? I know it's a lot of information, or I can complete it and then we can discuss afterwards.
Why don't you go ahead and finish the presentation, and then we can come back with
Perfect.
some questions.
Sounds good. So I wanted to illustrate a little bit on this fund balance or fund balance breakdown. So I know it's small. Hopefully, if you can take a look at it, I'm trying to make it a little bigger, but I really want to concentrate on the 24 and do a comparison as what I just discussed, the comparison between the budgeted and the actual projection. So if you take a look, I highlighted two important definitions. These come directly from your financials every year. The auditors, obviously, so assigned and unassigned. So what I did is I broke down your fund balance specifically as assigned, unassigned, committed, restricted, and then I added a line that has a percentage of reserve, so you can get an illustration of where we're at within our percentage. So within 24, what we originally budgeted prior to October in the August meeting that was presented is we originally we were projecting that at the end of 24, we would have 2.8 million in us assigned, which the way we got assigned is we take to balance the budget, whatever was prior when we're actually finishing up the budget, whatever is needed to balance that budget, that's how we get that number. So that was what we needed when we projected prior in 23 for 24. We said we were going to use 2.8 million. Okay. And then unassigned is available. So at the end of 24, we are saying that we would end with only 944,000. And then committed, we've been pretty steady since 21 to commit 500,000 for emergencies. And then the restricted, which is done by calculation, our reserves, it's 3 to 5%. It's 263,000. So that's what we projected. And what I want to point out is the new projection after August, now as of October, looking at actual instead of budget to budget. In 24, we're anticipating that we will have assigned 2.8 million. And the reason why I use the 2.8 million is that 2.8 million is the three priorities. If I sum up the three priorities that we requested to the county from general fund, I want to be specific, just general fund, it's 2.6. So I use that. So if we used to fund the 2.6 or the 2.8, which is all the priority, we would still have unassigned 5.4 million available in fund balance. And then also committing 500,000 and then doing the restricted of 464,000, leaving us with the reserve of about 24%. So move on to that one. So the significantly improvement means that by the end of 25 with this surplus, positioning us to fully fund all identified priorities. As a result, we would recommend withdrawing the county's general fund request for the priorities 1, 2, and 3. The stronger reserve gives us a greater financial flexibility and stability, ensuring that we can address and potentially challenge and potentially address challenges and continuing our goals for 24 and beyond. And so since I gave you some good numbers for 24 projections, I want to kind of illustrate a little bit about 25. So what I want to illustrate here is if we begin 25, we would start off with about 9.2 million in fund balance. So here's some assumptions. I want to just kind of be clear on the assumptions. The surplus projection, we anticipate no surplus at the end of the next 3 years. So that means if we budget correctly and we're within 2%, we shouldn't be adding so much fund balance as we've been doing prior. And then also we'd pretty much be at a zero base. And also inflation. So I added a 5%. And so in this case, I'm not using the 5%, but as we project for 26 and 27, I would add a 5% inflation rate to see where we'd end up as far as our reserves. And then also revenue, I didn't add any. My assumption is I added a flat revenue without adding anything, just so we can be conservative to kind of see what it'll do for 25. And in that case, right now, we'd start off at 9.2. We would use the 2.8 that is designated as priority 1, 2, and 3. We would still have a fund balance of 5.4 million available, giving us a 24% reserve.
You have another box here. If you click, you take one more box.
Oh, the assumptions? I just went over them.
Oh.
I memorized them.
Nice.
Yeah, I just went over all that. So to update the 25 proposed budget, we would follow several key steps to ensure accuracy and reliability. First, we would review actuals from 22 to 24 to establish a more accurate baseline for 2025. This historical data will provide valuable insight to our financial trends and performance. Next, we will revise projections by updating our revenue and expenditures forecasted based on the correct data. This includes recalculating salaries and line items, also looking at the fringe rate and accounting for any new revenues and funding cliffs that may impact our budget. The team is currently working with divisions and understanding program budgets to adjust to 2025. And we would also revise our county funding request, which is the general fund. I want to be clear, it's the general fund request, the priority 1, 2, and 3, and get direction from the board and support to rescind those requests. A little bit of the timeline. So our next steps are real straightforward. We plan to correct the 25 budget right after, obviously, we'd like to communicate to the county as a direct, hopefully we get some direction from the board. And then second of all, we'd be working with the departments, and we want to make sure that we present a proposed budget to the board for 2025. And then we'd also come back December 16th for a final adoption. So we do have on the books having another budget session retreat, and it really is to kind of just update the 25 budget, because there is going to be some changes, obviously depending on operational needs, depending on the priorities and the direction that we get. And so continued focus. So looking ahead, we are focused on several key areas to improve our budget process. Strengthen the internal controls, which we already started establishing. Sarah and Desiree are looking at, strengthening our controls. We're emphasizing transparency to ensure that our numbers are accurate and accessible to stakeholders. So we're looking at reporting, monthly reporting also to the board to make sure that we are reporting on monthly expenses and expenditures, looking at the actuals to budget. Especially for 25, making sure that we're in line, making some metrics to make sure within budgets. We'll also continue to use actual historical data to inform projections and reduce the chance of some of these I wouldn't even say that, just over budgets or inflation. We are also enhancing our review process to ensure that all systems and platforms are aligned and consistently updated. And that is working with the county. We're trying to establish some collaboration, making sure that all our systems, even our internal and then the external, are all in line. And finally, we're promoting proactive collaboration with the board and the key stakeholders like the county to maintain alignment on open communication throughout the budget process. And so this concludes my presentation. I'd like to open the floor up for any questions, feedback, or suggestions how we can continue improving our budget process. We're committed to ensuring that our budget accuracy reflects our financial reality and supports the work that we're doing as we head into 25. And before I conclude, I'd like to thank the financial team. They've done a lot of financial analysis. Desiree is, I've been here 33, I keep saying 33 years. It seems like it's been a long time, but 33 days. And I've been asking for so much information, so I appreciate that. Sarah's fairly new, and she's willing to go out and work with the department or the divisions and programs and just really understand the business. And then Jerry and Jessica for doing all the analysis for us so we can review. But I'd open it up to some questions.
Can I make one clarification?
Yeah.
Real quick, Armando? Yeah, so what we are proposing is to rescind our county general fund request of $2.8 million for 2025, but to keep our $7 million general fund base funds, as well as the HHS B1A funds and the sustainability tax requests. Just to be clear, rescinding those three priorities that total 2.8 million in requests wouldn't create a sustainable financial model going forward indefinitely. It would probably be feasible for 1 or at the most 2 years, given current expenditures. After that, we would need to reassess county funding needs and our staffing levels, which would be based on the same positions we've already identified as county funded positions unless we're able to secure new funding for them. And that we would also ask that the county recognize year-over-year BCPH COLA and merit increases in line with other county staff.
And we would come back with a deeper detailed plan to be able to ask for those needs in the future. But I think right now we're really addressing the 24.
25.
Or 25. Question?
Can I ask a quick timeline question first to start off? So, Armando, I know that you are new eyes coming in and looking at this, but we would like to still continue with the external audit to make sure that all of this is correct. will we be able to complete that by November if we're going to be asked to, are we going to be asked to approve in November, or are we just going to be shown the updated budget in November? Because I know that some of the board members, we would like to have the external audit completed before we vote.
So just some clarity, it would, when you say external audit, it's actually just looking at our process, how we came up with these numbers, because it's not an audit. It's really looking at,
Sorry,
Um,
it's not a, it's
yeah,
not a proper audit. Our
It's
review,
okay.
our external
it-
review.
it would look
Sorry.
at a review of the information that we're providing here. Because what we've done is we've looked at financials for the last, I've looked at their financials for the last 5 years. So we've left messages. Hopefully we'll have a better timeline as far as what do they need and kind of scope. So I can't promise you that that'll be done. So that might be conflicting. We might have, we'll have to see what kind of timeline they give us. But we have till December, to adopt December 11th.
We have until December 16th we have until December 31st to adopt the 2025 budget. But the time pressure that we have is that the sooner that we can get back to the Board of County Commissioners about our 2025 request and an accurate projection of what we'll need in 2025, the more helpful it is for them in making budget decisions. And I know that they will be making final decisions November 2nd. So our aim is to basically have our external reviewers confirm numbers prior to that to make sure that we can communicate back to the Board of County Commissioners in time for them to make their decisions. And then we will come back with more specifics about the 2025 budget that reduces some of the excess that we were able to identify through artificially high fringe rates, as well as comparing it to our 2024 actuals that will give us a more accurate 2025 budget picture. And that's what we'll review at the budget study session in early December, which will be after the Board of County Commissioners has made their decision and prior to presentation of the proposed budget for 2025 that will be presented to the Board of Health on December 16th.
So Lexi, I'm confused about what you're putting on the table tonight. If you're saying that you want these numbers to be reconciled prior to the conversation with the commissioners, what are you saying then? Are we rescinding and we're no longer going to be putting anything in front of them? Or are we rescinding with the potential to put something else in front of them?
No, we are confident at this point that the reserves that we have would cover that 2.8 million and still give us adequate reserves over 15%. So we would like direction from the Board of Health about whether you would like us to rescind the 3 priority requests above our $7 million base to the Board of County Commissioners. And then we will be able to come back in the next couple of weeks with much more specific numbers about the reserves, but we have a very high degree of confidence that 2.8 million would not take us under our reserve limit.
So I have several questions. Morgan, Brooke, should I go or how do you want to handle?
Can I add just
We
a
all,
quick?
I think we all have questions, so I guess go ahead and run through yours and then
I have a quick
whoever's not covered.
on
Okay.
timeline, because I did have an initial conversation. I believe you were like Lexi, you were in that conversation as well. And the initial conversation with CLA is not that it would take 2 weeks, but that it would take, I believe, 6 days.
For the whole project, but
Yeah.
this is just to review the 24 numbers related to the reserves.
But I
Sorry, I
haven't
missed
heard
that.
anything
Did
back
you
from them.
say-
So
Sorry, did you say 6 days or 6 weeks? I missed the time.
8 weeks.
But
with the
that's
timeline.
for the entire internal controls project that we're working on them with. This we would fast
Got it, got
track.
So for 24, we have a fund balance that is different than what we were told last time.
Yeah.
How much of that is unspent county funds?
So the way we do fund balance is we throw everything in there. I would say that all of it is fund balance from the county because it's been year over year that has been accumulating. So there's some additional information that I can give, and I just already know that. So over the last 8 years, we've added about 500,000 on average every year to fund balance over the last 8 years. That is your official audited financials. So if you go back to the presentation they gave you in August from our auditors, it's right in front, page 48 and 49. If you go in there, you'll see how much fund balance we have. So we started off the year with $7.1 million in fund balance.
So Lexi, my understanding based on our conversations with the commissioners is that they expect that we spend all of our county funds. And if we don't, that we need to have that conversation. So what are we projecting? Because what I don't want to assume is that we have a surplus based on artificial assumptions that aren't necessarily reconciled with the county.
Right. So historically, we have never returned county funds. That's just been the practice. We have had conversations about whether we should. I don't believe there's been a formal decision about that, but I think that the issue you're pointing out is clearly relevant, and we would want to be clear about that in relation to the resending of the request.
Right. So that's my concern, is that based on this conversation, we have an unexpected surplus. There may be an expectation from a commissioner or multiple commissioners that that is returned. We need to understand the implications of that, right? So it's not just the added 2 point.
Right. Well,
We might get rollover money from indirect and other.
I don't know.
So,
I mean, I don't.
so
think
that's part of what we'll dig into, and you'll be able to present to you at the next conversation. Part of the challenge has been that we didn't have a system for tracking those flows. Because the county only gave us $7 million this year, I am very confident we will spend all of the county funding this year. Historically, going back.
But it sounds like
That's a
we have
different
quite
issue.
a bit. It is October.
Yeah.
So I would like to understand that spend down. What is our expectation? What is that run rate? How does that compare to the past 7+ months?
Do you want to show that slide? Yeah.
And there are things like, we delayed hiring.
Yeah, so that's another thing that I want to talk about. So there's been some very conservative approaches over the last 2 years. So we continue increasing fund balance. So we need to be careful about mentioning that we would return, because I believe there's still a need. It's just we need to get back to the basics, I call it, to look at our budgets and making sure that we're providing the services. So we really need to sit down. We've been very conservative about, hiring freezes. It's taking 100 days to hire somebody to fill a position. That adds up some salary savings. So there's a lot of variables within that we can still control to be able to provide services. So keep that in mind. We've been very conservative. So I think this is the year to really reset. So in 25, we can look at those actuals to really see where should we be. I can tell you that we're averaging, if I looked at the last 4 years, and we're averaging about on expenditures, about 22 million. And we're budgeting at 26 million. So we're averaging about 22. That's pretty consistent over the last 4 years. So we need to really look at our budgets in 25, and really our budget should be around 22, 23. You have to add an inflation factor to that. But if you look at our budget for 24, $26 million there's a slide in there that I pulled out, but we budgeted 26,000. It's not in line over the last 4 years. We're within 22. Even revenues came in a little bit higher, but then we had some unaccounted for revenue that came in because they're reimbursements. So that's why it came in. But we've been within 2%. I think in revenue, our revenues are pretty conservative and pretty steady. So we've been pretty good about budgeting with that. But it's really the expenditures. And I really believe that it happened because of COVID. Your budgets really blew up, and to manage those, we should have been looking at budget to actuals. But, we just started budgeting because of COVID, and you see that with a lot of organizations. So it's really getting back to the basics. But that slide, which one did you want me to show them?
Can I just tag team onto that question though? Do you show that we are spending all the grant money?
Yes.
Okay, so we're not counting grant money.
Yeah, the thing with grant money is there's a lot of regulation. So we have to follow that. We lose it, right? So that's why. And then if we don't spend it and we get it, it's a prepay, it becomes a liability. You're not going to see it under fund balance. So that's why it really is a historical. if I can see which one, I think it's the one that says zero.
Slide
here.
6.
Yeah, and we rarely get a prepaid grant.
Slide
Like-
6.
Yeah.
We're
Sorry, 2024 financial.
Potential.
2020.
with all the programs to spend on their grant funding. I think sometimes we generate revenues
Yep.
from fees and sometimes we generate, we have indirect dollars. So I think the rule is always to
And-
try to spend on.
I'm having a hard time with the logic flow in this conversation. So what we're saying on one hand is we know we're gonna spend this down, the county funds. But on the other hand, we're saying we consistently spend the same amount every year and we have a $4 million delta in our budget relative to what we typically spend. So help me understand that distinction, because what I'm hearing is that we have an inflated budget.
We do. If you want to go to that slide for me and I'll show you.
Yeah, give me just a sec. I'm trying to pull it up here.
And then I'll also show you the information that I provided you on the fund balance. Those are audited numbers from your financials. So I'm not making any assumptions based on that. So I'll show you how we're getting that delta.
But that delta is important because I just, again, I don't
I
understand.
don't get it.
Yeah. Sorry, there's, hold on a second.
Yeah.
There's multiple conversations, so the mics were picking all of this up. So let us get the slide pulled up before we continue these conversations. Sorry.
Yeah.
The recording won't do it. All right, stop sharing.
Yeah, see, it doesn't even think I'm sharing.
And then just, show the PowerPoint.
Let's try.
Then-
Because you can.
There it is. Okay. Sorry, everyone.
Just build it out.
Yeah, build it out for me, please. I'm not going to present it.
Whoops. There we go.
Okay. So if you take a look at this table that I'm going to be presenting, so actuals for 22 and 23, as you can see, we'll talk about revenue. So these are actuals. I'm looking at actuals. The only budget I have in here is for 24. So your actuals for 22 came in at 22 million. 23 was slightly higher at 24. You had ARPA money coming in. And then your budget for 23 was 23 million.
24.
24 was 23. So to my point earlier, I think within the revenues, we're within 2%. I even put it in there favorable by 2%. So I'm not too concerned on the revenues, they're pretty steady. This is where I really want to point out. So we've been steady. If you take, I did from 19 to 23, I took out COVID. We're about averaging 22 million in 22, 23 million in 23. We budgeted 26 million. We're coming in about 22, which is the average. That is 17% underspent. And so that's where we get that big delta. It's coming from, so I want to point out where it's coming from. So if you look at what we're projecting in 24, we're going to come in higher on revenues, and that is because of this line item, the other finance resources, and that is because I have the breakdown for you on the 2 million. On the 2.5 million, that is made up of, we have some addition, we had a transfer from mosquito, public health mosquito. We had ARPA replacement, which was 1 million, so that was unexpected, not budgeted, so we're getting an extra million. We have some ARPA Family Connect, which is a 400,000. We have another ARPA for 267,000, and then we have some climate justice, which is 121, and then we have BCHHS for 49, which makes the 2,500,000. That's where the access revenue is coming in.
So sorry, Armando, I appreciate the detail that you are adding as background here, but this feels like this is a much bigger detailed discussion that we need to have. And I was anticipating that we were going to have as part of our budget study session upcoming, because you're referring to numbers, but we can't actually see those. I'm just hearing them. So I just want to make sure that I want to take a quick step back on the agenda and what we need to do this evening, and then what we need to do as part of a budget study session with a much more focused conversation with all the details that we're referring to, but don't actually have in front of us.
Sounds good.
Yeah.
Because I think what we have heard you go over is that you're projecting that we're going to have excess revenue. I think we still, as a board, have a number of questions about what's making up that revenue. And again, are we sure that it's county funds? And when you estimate 500K per year over 8 years, that's $4 million. So we need to know where that money is coming from, and we need confidence in where that money is coming from. But again, that can be part of our budget study session, and we expect to have that information as part of our budget study session. What we are hearing you say tonight is that you are recommending that we rescind our amendment request to the commissioners, and we as a board need to decide, do we think that is something that we should do based on the fact that we know that the county commissioners are facing themselves a tight budget, because we are still awaiting more information ourselves. Should we rescind that amendment request in good faith and then await further information and spend our budget study session going through all these details? Does that
Yep.
align with what we what we need to accomplish for tonight? And also, I want to, because I think I have a number of questions still. I know Brooke has a number of questions. I know Lindy has questions. I know all of the board has questions about these numbers. And we need to have a big conversation about that, and we need more information and details about it. But I don't think that's what's on the agenda for tonight.
Perfect. Lindsay, I think you had.
Yeah, my only other comment on this is it's, yes, we can rescind that, Morgan, but I think we're still gonna get scrutinized over the acts outside of that. So I would suggest that from a procedural perspective, we absolutely need to rescind in good faith to the commissioners and to the county. I just don't know if we are coming with a different ask ultimately. So what I would ask is that we have an external party come in as quickly as possible on behest of the board to review our 2024 budget first, which I think, Lexi, is what you're saying. Make sure that we are clean on our 2024 budget, because our budget for 2024 goes into our ask for 2025. And there may need to be a discussion about county funds even for 24. So I hear the words, we're going to spend it all, but I do not have mathematical proof of that, nor do I have somebody externally validating these numbers, which have changed significantly several times.
So I just have a question. You said spend it all. I don't think we ever said spend it all. We just don't believe we're going to use fund balance. We're adding to fund balance. And then if we project in 25, we will be using some of that fund balance to take care of the priority 1, 2, and 3.
Yeah, I think Lindy is referring to the county general funds of $359.
If you go back to your slide, it shows that we're gonna spend it down. So if you go back to that slide. That one. So if you look at the expenditures and under workforce.
No, it's
So-
not workforce. It's the county
Under
payment
the
under
workforce.
revenues.
Yeah, it's the county, where is it?
It's
The county payment.
PH
County
13.
payment.
PH 13. So we budgeted 6.1 million and we're projected to spend at the end of this year 7.5 million.
Well, that's the salaries, and then there's also
that's-
operations. We will have overspent PH 13.
We will have overspent from the county funds that.
This is not the appropriate time to get into this level of detail. I would like a walkthrough to understand specifically how county funds are being handled in 24 relative to our request for this year. And as we build on our 25 budget, that we, in good faith, can say to the county and the commissioners, this is our ask, right? And have it validated so that because everything builds on everything else. So this is, we need this validated. We need this validated. 24 is just as important as 25 for these purposes.
Yeah, we agree with you, and that's what we're working on now.
Okay, but. All right, I won't push back. But these are coming from our Oracle system, which is our record. So,
They're the actuals.
yeah.
I want to make sure that we get Brooke an opportunity to jump in. You're on mute, Brooke.
Too many buttons. Yes, so absolutely, I think we should pull the initial ask for priority 1, 2, and 3 for sure. I just wanted to put something else out there for the budget review session. It's something that I had in my notes from our subcommittee meetings, but I don't think I've voiced it yet. And that is that we hear quite a bit that the county has been holding back over the last 2 years. And I know, Indira, you mentioned again that we've waited to hire. I think as part of that discussion, we need to know what are the things that we have been particularly frugal on in the department, so that we can have that explicitly written out. Because for me, the workforce, $3 million just really stands out, and I'm not sure that we can explain that away with a lower fringe rate. So perhaps seeing what are the open positions that we want to hire for that the department has not hired for in the last 2 years, and where is money being excessively restricted that you would like to see opened up more. And I think that if we can see that detail, that will really help so that it's not this ambiguous, we've been holding back or we've not been hiring. So if we could see that during the budget session as well, especially if that's, I'm sure that'll come up. It's come up in all of our discussions. So if we could see those details, that would be helpful.
Sounds good.
Yeah, I think we've also heard in all of our past budget discussions about anticipated funding cliffs and, ARPA funds that are no longer available after this year. And, I think we had been talking about, we're gonna have to dip into reserves to cover those, dip into reserves. So that's another part of what we need to talk about at that budget study session and see how this impacts those reserves going forward as well.
Yes, and we have been collecting that information. Sarah's been meeting with all the different programs who are experiencing funding cliffs at the end of 25. Which is good. What we can anticipate. Correct.
So do any of the other board members, and I'm sorry, it's hard for me to see the whole room from the screen, but is there anyone else that has a question that is really pertinent to the decision or the direction this evening to pull the amendment request? I want to make sure that everyone feels comfortable if we're going to vote on that, or are there any other questions that board members have around that particular decision? I can't actually see if you're nodding. Yeah. Okay.
Yeah, I think we should be able to cover priority 1, 2, and 3. I think how at risk are we of maybe losing or decreasing the 7 million base that we're still requesting?
I'm not sure we can answer that.
Hey, we've had conversations with them, but I don't want, yeah.
And what do we need to bring to that conversation to not risk the same? I mean, some of the projections about where we've been frugal, but shouldn't be other ways that we're planning to spend those funds.
I think kind of the caveat that I presented about, it looks right now like we can definitely handle that reduction for 2025. And then within the next couple of months, we should have a clearer idea of whether, does it go longer than that, or, kind of what does that projection look like? I think one of the values that Armando has brought is really clarification of how to use some of our data really effectively to tell a story. And it is enormously helped me to understand some of the structures and balances that are happening, but that extra level of detail and some of the things that you all are asking questions about tonight are exactly what we want to be putting together before the budget study session.
I think it's hard because we're voting to pull the request before we have the budget study session. Is that where we're feeling the tension?
Yeah.
I'm feeling the tension more around the 7 million. I think the pulling this, in my opinion, and I think we're generally aligned, is a no-brainer. But what I'm really concerned about is our ability to justify a $7 million ask. And Lexi, that is supporting exactly what you just said, which is it's not just about the added request this year, which, it's about our fundamental ask. And I want that to be airtight, rock solid, no questions asked by the board and by an external party that can validate that for us.
Well, I mean, I agree with other board members' concerns about whether or not this is going to impact our base funding ask as well. So, I don't know that there's much we can do between now and their meeting on November 2nd unless there's additional information that you think is going to support that base funding ask that needs to be submitted. I do think, we have a lot to discuss at our budget study session. Can we, let's see, I need, I guess a motion, I think, to give the direction to pull our amendment request.
Yeah, I move that we pull our 2025 amendment request to Boulder County.
Second.
All in favor?
Aye.
Aye. Okay, so please do pull that amendment request. I know you are in regular communications with OFM. So if you anticipate that there are going to be any other changes to the base funding consideration, we want to know that right away. And then let's expect, I think our budget study session was rescheduled for, I can't remember the date. Is it early December now? No, it's still in November.
December 3rd.
December 3rd. Okay, so it is early December.
One prior, before that one, to give a lot of information.
Morgan, when are we approving the 2024 amendment?
Yeah, that's a question also then, because about timeline, when can that happen if that needs to be part of that CLA review?
Yeah, I think we should be able to have it to you by the November meeting.
But Lexi, that will not be in time for the commissioners' discussion, correct?
It won't matter to them,
24 won't?
the 24, because it's just a budget amendment.
Okay. But it's really about the basis for 25.
We will have all of that.
Right, okay.
Okay, well, we have a lot of questions, and I think Armando, we have tried to continue to show our appreciation for you coming in and again, increasing transparency and our understanding of the budget and making sure that we are as accurate as we need to be to really run a sustainable organization. So we appreciate you doing some hard work. We appreciate the ongoing work of the whole team to really get to the bottom of this. And I think you hear from the board how important this is to us to have accurate numbers that we can count on consistently. So thank you for continuing to try to move us in that direction. This is really a top priority and has been for us for quite some time.
Sounds good. Thank you.
Okay. Item number 7 is the director's report.
Okay, so a little report on communicable disease. We did have a tuberculosis case in one of our schools. We've been working significantly with Denver and Dr. Belknap to mount a response, making sure that we are testing kids who may have been exposed. We have not identified any other cases so far. Fingers crossed. Ginger, is there anything you want to add on that one?
No, I just a few things. One, I just want to give Stephanie Farron a really big shout out. Her and the team with Chris Campbell and Carol Howig have done a phenomenal job in this response. Obviously, these can be very highly political because they're in schools. And she has really stayed in strong relationship with the St. Raymond School District. Really positive to see that.
Testing is ongoing this week, so we don't know yet, but we are hoping that no one else comes up positive. And thanks to Dr. Belknap and the team in Denver for their support. And then some good news. I don't think I announced it last month, but Louisville City Council passed the healthy drinks menu. Oh, I did announce it. Okay, I was all right. Well, I'm going to announce it again. Louisville City Council passed the healthy drinks menu after 2 years of work. And I think one of the things that I've learned since then that was quite remarkable is that the team got every single restaurant in Louisville to sign up except for one. That's pretty remarkable. And that team's work in this space continues to be recognized internationally. What do we need to do to get superior?
They got Longmont already.
They got Longmont, they got, I don't know who they're working on. Rachel told me, but it's going from my mind.
Where they're headed next.
Yeah, it takes a while. But the team has done such a good job, not just of anchoring that work in Boulder County, but really creating a model for working with our surrounding counties. And expanding the model, and they get questions all the time from around the country. How do we do this? Which I think is a real tribute to not just to their success, but to the recognition of the quality of the work that they've been doing. So it's exciting. I have no other announcements from the director's report to elevate.
Hey, Lexi, can I ask a question? There was a section that I literally just didn't understand. This is the air quality and healthy homes bill. That was passed, I think, in May. And it sounds like that I'm reading this to see like there's some confusion about the authority of BCPH as it relates to this bill. Could you just sort of expound on this a little bit? And if not, I'm happy to talk with the expert on this internally, but it struck me that there might be some tension with the community on this, and I wasn't clear what was going on.
Yeah, so this really has to do with us getting nuisance threats from the community in relation to hoarding situations. And this is a conversation that we've been having with Kate Haywood out of the county attorney's office. And because we have launched this Healthy Homes initiative, there maybe have to rein in or clarify for folks a little bit about kind of what that program is about and what our authority is. We don't plan to get into the business of addressing hoarding issues until there's a direct public health threat. So I think that that's what that reference was. But I've also been working with Kate, and she will be sending you all a memo to update you on legal issues that we're talking about related to just board awareness of policies. And you should be getting that by the end of the week, I think. And that'll be probably a reasonably regular, maybe quarterly report to you from our legal support.
And I think there was a state bill that also passed that has created some challenges because of between tenants and landlords.
Thank you.
And so the problem what the problem is that people are like, well, who do I call? I'm going to call public health. And it's not something that we don't navigate those waters.
That's kind of what I was reading.
Yeah. So lots of challenges from the public seeking help and not knowing exactly where to go.
Is there a partner that we defer these calls to, or how does this?
The environmental health team is really strong and has a list of partners that they refer to. And I know that Joe is here. I don't know if he's listening, but he is happy to jump in. But I know Rob Martinez often fields a lot of calls and questions. Same with Bill and Aaron.
Okay.
You want to add anything, Joe?
Sure. Joe Malinowski, Environmental Health Division Manager. Good evening. I think Lexi did a good job summing up our responsibility, but I think we do get a lot of these calls, and we always try to give a resource, and most of the time that resource does go back to code enforcement because a lot of it's substandard housing, and they usually have the nuisance and the ability to better address it than we do with the public health regulations. Public health does have the ability to do nuisance, but it requires a Board of Health order or Lexi to do a public health order. So it's pretty cumbersome. So, and we traditionally have not done that in public health. We really focus more on the true public health issues, not necessarily the nuisance issues for individual homeowners. We do try to, again, leave that to the municipalities, and our own code enforcement, planning and permitting has a whole wing of folks that do code enforcement out in the county as well. We try to support them, but we don't necessarily take the lead on those.
Thank you. That's really helpful. And then can I ask one more question unrelated to others? Okay. I just needed a friendly reminder from the team. Hold on. I have to so I know we continue to collaborate around the behavioral health roadmap. Can you guys remind me, are there time markers when we'll come out with a broader strategy and realignment potentially? I'm just curious kind of where we are in the evolution of that conversation. So we, yeah, who wants to take this one? I can start and then jump in. So in terms of the county's larger behavioral health roadmap, we handle a lot on the prevention and harm reduction side. And we promote early intervention, but we don't do direct service for early intervention. So what we have been talking to Dave about is that they're working on the strategies for the strategic plan. And we also have to realize that there's this fiscal cliff coming up at the end of next year. So we need to start prioritizing our resources and really identifying kind of the path forward. So if there has been talk of a ballot initiative, we don't know. But the commissioners have been pretty active in the town halls talking that they would like to move in that direction. So I think we're just trying to get our ducks in a row in preparation for that. And most of the prevention and harm reduction work is pretty, like, we're starting to stabilize, but the prevention work tends to be less grant. It's harder to find the grant opportunities to do that work. Harm reduction with all the opioid litigation dollars and things coming along in that, it tends to be better resourced right now, which was, 5 years ago, I would be like, we need money, like, help us. But it's so much of the landscape has changed. So I think it's just going to be a focus more in that prevention space. But we're having a meeting at the end of October to start kind of looking at, with Sarah actually, to look at the fiscal cliffs, look at the budget, look at and predict and project what's going to happen in 2025. And how do we use our communications resources effectively to kind of share the stories of isolation, share the stories of recovery. How do we kind of take that out into community in more of a population-based approach? Is that?
Yeah, and I'll just tell you from the, I'm on the executive advisory board, and part of what we've been talking about in that space is really kind of further prioritizing, thinking about how we frame public communications, and this issue of the timeline, particularly in relation to the timing of funding opportunities and challenges. But the point that Indira made about our mental and behavioral health strategy, which is also our public health improvement plan, is our work in that roadmap space. So it's not particularly slowing us down at this point.
Okay, that's helpful. Thank you.
And I believe the county, the community services is going to be launching an anti-stigma campaign. So it's just really trying to promote getting people to refer them to services, which we know is always a barrier.
Yeah.
We are wealth of random information.
That's an understatement.
Any other questions on the director's report?
Nothing from me.
Okay. Thank you for the prep work that goes into those. I know it's a lot, and helps us wrap our arms around all of the other ongoing work that isn't necessarily on the agenda every month. Item number 8, old and new business.
So I do have something, next slide. This is just a reminder for some rescheduled board meetings that we have coming up, both for board members, staff, and members of the public. The November regularly scheduled board meeting has been shifted to Tuesday, November 19th due to Veterans Day and budgetary discussions with the county commissioners. December has been shifted to Monday, December 16th, based on budget conversations with the county as well. I wanted to ask the board and Lexi, typically we have an executive session for your performance evaluation. Do we want to move forward with this? And are we wanting to have this before or after the board meeting in December?
Um,
No, we can open it up, we can come back to it.
I look at my calendar.
If we, can Amber and I take that away? Because, yeah, I think that we want to have some discussion around.
Okay. All whatever. Yeah. Okay, yeah, perfect.
Yeah.
Yeah, so just let me know.
And yeah, Lexi, we want to confer with you too.
Okay.
Can we get meeting invites for the rescheduled regular Board of Health meetings?
I need to look at our communication from our Outlook to your Google, because it's recurring. Are all the rest of you getting the updated calendar invite? So yeah, I think it's Brooke. I'll check with you offline and we'll figure out the issue there.
Okay, thank you.
And then the rescheduled budget study session for Tuesday, December 3rd. And a reminder that the Board of Health annual trainings from CDPHE are due by December 31st. Like,
Jordan, keeping us honest.
So can I just clarify? We talked about the budget study session in early December is for 2025. Are we also then going to have a budget study session before the meeting with the commissioner? Like, help me understand. I'm still a little confused about what our next steps are.
So we're going to be working with CLA to look at our 24 numbers. And we're going to come back to you all with more detail. We can either schedule a special meeting, or if we want to wait till the November meeting and we have checked with folks and there's no urgency to it, we'll address it at the 24 amendment at the November meeting. We'll request to resend the 3 priority requests from the BOCC that keep our $7 million base, the sustainability tax and HHSB 1A, since those aren't related to the general fund. And then at the budget study session in December, we will go through an update of the 2025 budget, being sure to incorporate the past expenditures, the actuals, so that we are removing any inflation that we have experienced over the past couple of years, that will give us a more accurate picture of our budget for 2025. And then that will come for your proposal in December.
I guess what I'm a little confused on is we're asynchronous with the conversation with the commissioners. So how wouldn't it be helpful to have this analysis done and an external validation prior to meeting with the commissioners? That's what I'm trying to understand, because obviously that's not the full budget, but that will be a significant impact to the budget.
So we're trying to get the meeting with CLA expedited for this week.
Yeah.
I mean, the reality is the commissioners can see Oracle. They see what's happening.
Yeah. Yeah.
So, I mean, in terms of an official request, I'm not sure it matters too much if it's tomorrow or next Monday. But we're happy to keep you all up to date and walk you through the conversation with CLA as soon as we can get that scheduled.
When is the meeting with the commissioners?
We don't have a meeting with the commissioners.
Oh, okay. I thought there was something in November.
November 2nd, they will announce their budget decisions.
Thank you. So there's no meeting with them prior to that.
It's a budget hearing that they have where they decide whether or not they're funding all of the departments and at what level.
Yeah. So
There's a public comment meeting tomorrow.
right.
Yeah, where they can hear from public.
just want to make a quick note, if anybody goes into OpenGov, we worked with the county, so we are aligned with what was originally adopted. Unfortunately, the visual that you see when you go to OpenGov, it shows a balance or a budget of 34 million. That is incorrect. It's been corrected. We've worked with the county. They just say they locked it at the beginning of the year, but Oracle and OpenGov are balanced. So in case you go in there and look at the visual, they won't adjust that, but it has been adjusted in our books. So I just want to clarify that because it'll show that we still have a budget of 34 million with a deficit of 11 million.
They won't have, they don't have access.
We
to-
don't have access to
Yeah.
Oracle or OpenGov. We rely on you all to
Oh, okay.
bring us that
Yeah,
information.
Just,
But
We'll work on that for 25.
in the budget protocol dashboard, it didn't reflect the 34 million. So it's not an issue from what the commissioners see.
Okay.
They never saw that 34 million.
so just clarify in case you had access to that dashboard, I don't want you to say, hey, whoa, you showed another number, so.
So the good news is I did get a email today from CLA about the kickoff. But the challenge has been we just got approval from our legal team at the county to proceed with the contract a couple of days ago. So we're moving as quickly as we can in that area. It turned out that we couldn't piggyback on the county contract, so it's taken this long to get the contract reissued.
Thanks, Desiree.
Okay. Well, thank you, everyone. Look forward to deeper and more detailed discussion going forward. But thanks, everyone, for this evening. Item number 9 is adjournment. So adjourning this meeting.
Thank you.
Thank you all.
Thank you.
Thanks, everyone.
Yes.